Tracy Granzik from St. Charles, Illinois, and I'm a Patients for Patient Safety champion.
My name is Lisa Stewart. I represent patients and caregivers, and I'm a healthcare consultant.
My name is Greg Anthony Masters. I'm from San Diego, California. I'm here as a patient advocate representing my deceased son, Anthony John Masters.
My name is Charity Watkins, and I am from Durham, North Carolina. I represent North Carolina Central University Department of Social Work, Duke University Department of Obstetrics and Gynecology, and Equity Before Birth, a nonprofit organization based in Durham.
What brings me here today is the fact that I've worked with a lot of really good people for a really long time who are continuing to work really hard to make sure that care is safe and equitable for everybody involved, including providers. And we still got a long way to go. So I'm here because I care about them and I care about care for the future for all of us.
I come to patient advocacy work through my own personal experiences of having two daughters that have spent an extensive amount of time within the healthcare system.
What brings me here is my own personal experience of receiving a delayed diagnosis, which happened about 8 years ago following the birth of my daughter. And I want to be here in order to help others from experiencing what I did.
A year ago, last June, 2023, my son was riding a bicycle after a semi-social gathering for his employer, and he was not wearing a helmet, and he wound up colliding with either a pedestrian walked in front of him or he veered into a pedestrian. He fell, hit his head, and he lost consciousness temporarily. EMS picked him up and brought him to a level 1 trauma center because he had a epidural hematoma and 2 frontal lobe contusions from the impact he hit the curb on the side of his head. So he was taken to the trauma center and they evaluated him, triaged him into ICU. He had a Glasgow score of 13, which is mild head trauma on that scale. And he was projected to have a 67-day length of stay, with discharge might possibly involve some rehab of speech, cognitive, whatever, depending. But other than that, relatively mild head trauma, healthy 38-year-old male, should get discharged 6 to 7 days. On the 6th to 7th day, he started crashing. He had significant health status changes, and he was left basically to rot in a telemetry monitored step-down unit. Day 3, he was transitioned from the ICU to an intermediate care unit, telemetry monitored. And on day 6, when I arrived at the hospital, clearly status change in his health. He was incoherent, groggy, went to non-responsive and then comatose within a couple of hours.
I think the HCAP surveys may have served its purpose years ago, but they're outdated, and I really think we need to blow them up and start over, to be honest with you. I think they don't capture the bias that occurs in healthcare for individuals, for providers as well, and I think that they're superficial, quite frankly. The questions just capture the mere basics, and they don't capture transparency, lack of transparency, outcomes of care. They don't ask the important questions. They're looking for the softballs and the soft answers.
We know that people tend to respond if they have a really good experience or a really poor experience, right? It's kind of the extremes often that you get the document reports on. But to your point, like having it right there available and accessible at the point of care or exit of care, then that's meaningful.
My stance on the HCAP surveys as they stand today is that it is not comprehensive at all, and it's more used for the purpose of seeing if a patient is satisfied with their hospital admission versus actually receiving detailed, deep information about a patient's experience.
So surveys at the point of care are a wonderful idea. I think that the environment has to be right for that, because patients and families would need to feel safe responding to the questions at the point of care. And that speaks to the bigger issues in healthcare that we still have to solve, and why I'm here, which is transparency in healthcare, open, honest communication in healthcare. All the things that make a healthy relationship in and out of healthcare should be available for patients and families when they go into a hospital or health system at their most vulnerable, that they ever will be in their life, most likely.
Too often we are collecting data that we do nothing with. And that has a number of different implications that are negative. First, those folks who we collect data from, but they don't see any outcome related to what they shared, and it oftentimes is very sensitive information. If nothing's coming from it, they don't want to do it again. They don't want to share their experiences again if the first time they did it, nothing changed.